Welcome to the training on key winter messages around influenza, also referred to as flu. This short training session has been recorded by Health Improvement Specialists from Leeds City Council. The training will provide key public health messages around flu, including types of flu, who is at risk, and how to protect yourself and others. This training will cover the following areas: Influenza Overview, Influenza Statistics, the flu change format, flu implications for 2021, flu vaccine campaign. The aim is to provide you with the key information which will help you support conversations when working with the people of Leeds to enable them to make informed choices about the flu vaccine. Most of us spend more time indoors during the autumn and winter with more people and generally in less ventilated rooms. These are ideal conditions for viruses to spread. There is an increased risk this year of the co-circulation of flu and COVID at the same time, which can be much more serious. Therefore, we all need to do what we can to help people boost immunity, and vaccinations are keys for this. Flu is an acute viral infection of the respiratory tract, which affects the nose, mouth, throat, bronchial tubes, and lungs. There are three types of the flu virus: A, B, and C, and it is type A and B that are more responsible for flu illness. To give a little more information on these types of viruses, flu virus A causes outbreaks most years and is the usual cause of epidemics and pandemics. Flu virus A is capable of infecting animals, although it is more common for people to suffer the ailments of this flu type. Commonly, it is wild birds that act as the host for this type of flu virus, whereas B flu virus only affects people, and although it is still highly contagious, it tends to cause less severe disease and smaller outbreaks. Flu has many symptoms, and common symptoms include a sudden onset of fever, chills, severe muscle or body aches, fatigue, a dry cough, sore throat, and a stuffy or runny nose. In young children, gastrointestinal symptoms such as vomiting and diarrhea may also occur. Complications in flu do occur and can affect anyone. They are more common in at-risk groups, which we will go on to look at later in the slides. Common complications can include bronchitis, ear infections in children, sinusitis, and secondary bacterial pneumonia. Less common but more severe complications can include meningitis and encephalitis, which is inflammation of the brain. On this slide, we will look at some statistics on flu. Information from the World Health Organization reports that flu can account for 3 to 5 million cases of severe illness, between 290 to 650,000 respiratory deaths worldwide. On average, in England, there are approximately 25,000 excess winter deaths reported annually. However, not all of these will be solely due to flu, but they are the excess deaths that have occurred over the winter months, December to March, in comparison to the rest of the year. Furthermore, figures from the UK HSA show an average that flu kills 11,000 people per year, hospitalising thousands more. For your information, UK Health and Security Agency were formerly known as Public Health England. We have already discussed the symptoms of flu, and have recognized that virus A and B can be highly infectious and can spread rapidly, especially in close communities. Virus A, as we have identified, can cause the most outbreaks yearly and is the usual cause of epidemics. In terms of transmission, this can be transmissible by droplets, aerosol, or through direct contact with respiratory secretions of someone with the infection. It has a typical incubation period of 2 days, although this can vary from 1 to 4 days, meaning that a person can be contagious 1 to 4 days before they start displaying any symptoms. Most cases occur during an 8 to 10 week period during the winter months. There is a diagram on the slide which illustrates the two surface antigens that make up flu virus A. These are antigen H, which is illustrated in blue, and antigen N is the one in red. These antigens are little protein spikes on the flu's surface that help to invade cells and spread throughout the body. There are 18 different types of the H antigen and 11 different types of the N antigen, which combined identify the strain of the virus. For example, you may hear the reference H1N1 or H3N2 to describe a specific strain of flu virus that is circulating. What is important to remember, however, is that the flu virus can constantly change and mutate as it replicates. Minor changes in the H and N surface antigens that naturally occur over a period of time as the flu virus replicates is known as antigenic drift. There are usually small changes that to begin with our antibodies will be able to fight off, but when these drifts accumulate over a period of time, becomes antigenically different and the body's immune system cannot recognize the new strain or fight it off. Antigenic shift is much more abrupt and major change to the proteins of flu virus A and results in the emergence of a new flu subtype which is novel and unexpected. Imagine this being a little like the emergence of COVID when a new novel virus was spreading and there was uncertainty on how to deal with it. And as we know, this can lead to an epidemic or pandemic. Bearing these changes in mind, it is important that the strains of flu are monitored and understood to ensure that vaccinations are developed for antigenic drift. Because of the changing nature of flu, the World Health Organization monitor epidemiology throughout the world to make recommendations about the new H and N strains to be included in the flu vaccine. Therefore, quite simply, a one-off dose of the flu vaccination is not enough to protect year on year. The vaccination must be administered every year to protect against the antigenic drift of the N and H antigens.
Although the flu virus mutates year on year, there is a clear trend that flu activity occurs between week 37 and week 15, so between September and March, where it significantly reduces as the spring brings along the warmer weather. What is also of interest is in 2020 to 2021 flu season, there were extremely low levels of flu activity seen across the UK than in previous years. But during this season, public health messaging, social and physical distancing measures, national lockdowns, local international travel restrictions, and the wearings of face coverings were in place due to the COVID-19 pandemic. Hospital and intensive care high dependency unit admissions for the flu seasons were much lower than seen in previous years. Now let's look at the flu implications for the 2021 season. As already mentioned in the previous slide, The flu levels were much lower globally last year due to the restrictions in place and public health messaging around the COVID-19 pandemic. Now restrictions have relaxed this winter will be the first year that in the UK where the flu virus will co-circulate alongside COVID-19. This has the potential to add substantial winter pressures to the NHS and the social care system, especially if infection from both viruses coincide. The timing and magnitude of potential flu and COVID-19 infection waves for the winter 2021 to 2022 are currently uncertain, but they may cause significant winter pressures on the health service. It is therefore vital that the distribution of the flu vaccine is given the utmost priority this year to protect ourselves, others at risk, and of our critical frontline services, to reduce excess winter deaths associated with flu, reduce hospital admissions at a time where the NHS and social care are managing outbreaks of COVID. So who is eligible for the flu vaccination this year? As always, the flu vaccination programme continues to support at-risk groups who have increased complications from the virus. We have already addressed that these complications may include illnesses such as bronchitis and pneumonia, or even meningitis, and it is therefore important that those identified within these groups are vaccinated to reduce the risk of complications. Groups eligible for the vaccination due to being at risk include over 65s, pregnant women, or women who become pregnant during the flu season. Those under 65 with underlying health conditions such as respiratory disease, heart disease, kidney disease, neurological disorders, learning disabilities, and those with weakened immune systems, and those morbidly obese with a BMI of 40 or above. This list, however, is not conclusive, and anyone with a long-term condition is advised to seek advice from their GP regarding their eligibility. As well as those at risk, the flu vaccination has been routinely offered to children since 2013 via a nasal spray from age 2 to the end of primary school. This was introduced to protect children themselves and to reduce transmission across all age groups to protect vulnerable members of the population. The expanded flu vaccination programme that we had last year will continue into this season as part of wider winter planning due to the likely effects of seeing both flu and COVID-19 in circulation. This means that as a temporary measure, the offer from last year for all of those aged 50 to 64 will continue to protect this age group, as we know that hospitalisation from COVID-19 also increases from age 50 onwards. Finally, the vaccination programme will also be extended to 4 additional cohorts in secondary school, so all of those from years 7 to 11 will be offered a vaccination. This means that this year's programme will be the biggest in history, with 35 million people being eligible for a free vaccination. With such a big cohort of people being eligible for the flu vaccination, uptake ambitions this year have been set for each eligible group. So for age 65 and over, the ambition is 85% uptake. Under 65s who are at risk, including pregnant women, the ambition is 75% uptake in all clinical risk groups. For preschool and school-age children, the ambition is 70% uptake for all of those that are eligible. It is also worth noting that all frontline health and social care staff will be offered a flu vaccination, with an ambition of achieving 85% uptake. This includes staff working in NHS healthcare, social care workers, and independent contractors such as dentists and community pharmacists. It includes housing support workers, personal assistants, and anyone who delivers direct personal care. What is interesting is that for the first time, there is now also an ambition around community uptake and the need to ensure that those living in the most deprived areas from ethnic minority and underserved communities have equitable uptake compared to the population as a whole in an attempt to tackle health inequalities. The key messages, therefore, in terms of flu for this winter season is to ensure that you and others around you who are eligible for the flu vaccination receive it, as this is one of the most effective interventions that can be provided to reduce the risk of harm and reduce pressure on the health and social care networks during the winter. It is important to increase flu vaccination uptake across all year groups this year. As mentioned previously, there is a potential risk of getting COVID and flu at the same time. For a number of years only, around half of patients under the age of 65 eligible for the vaccination due to being clinical risk groups have been vaccinated. And due to the uncertainty around the co-circulation of flu and COVID-19, it is important to increase this uptake. In terms of those accessing the flu vaccination, those over age 65 and under 65, but in a clinical group, will be contacted by their GP to book their vaccination at either a surgery or a community pharmacy. Pregnant women will be offered their flu vaccination by their midwifery team or by their GP. School-aged children will be provided their flu vaccination at school. However, parents will need to provide prior consent by filling in a form which their school will direct them to. Pharmacies can administer flu jabs for those who are eligible via an appointment and also offer a paid-for model for those who are not eligible but would like a vaccination. What can you do to help? The main advice is get vaccinated if you are eligible to reduce the risk to yourself and others around you. Encourage others eligible to get vaccinated. Ask questions and use effective listening. Provide the facts rather than personal opinions, and offer signpost and support. It is important to use age-friendly principles, effective communication, and treat people fairly. For further information, there is some available as listed on this slide, which includes the annual flu programme, the National Flu Immunisation Programme, flu immunisation for social care staff, and increasing influenza immunisation uptake amongst children. There are also many supporting leaflets available about the flu vaccination, a few of which, again, you can see on this slide. These include the flu vaccination, who should have it and why, flu vaccine supply, when can you get your vaccination, and flu vaccination for children, leaflets and posters. All of these leaflets are printable, and you can also order them from the Public Health Resource Centre. There are many myths around flu which are difficult to separate fact from fiction when understanding and educating others on the vaccination programme. Flu vaccine myths and the facts behind them can be found at flu vaccine myths and the facts behind them.gov.uk. Flu vaccine myths can also be found on the NHS website, flu vaccine nhs.uk. I hope you found the session useful to support you with conversations around the importance of the flu vaccine this season. For further information, please see the resources discussed or come to visit us in one of the Q&A sessions.